No one can ever make me shut up. No one. My first week here, we actually had doctors in the hospital, and we would actually go down to radiology and look at x-rays. All right? I mean, don't ask me why, but we did that, right? You'd go down, and you'd see this guy sitting there, talking away, almost talking more than me, but talking away, teaching someone. And I, of course, am not terribly forward, so I kind of meekly go throw my x-ray, my chest x-ray up, and I start to talk about this is, just puts his hand. I don't want to hear anything. And gives me what is, I believe, the best way that any possible consultant outside of the field of the person who's coming to talk to you can talk. He speaks in your language. He speaks as a clinician. He speaks as a person who has years of knowledge and incredible, resourceful, deep thinking to give you a clinical picture of the patient, which I think was the invention of the EMR right there. I think it was, because he was able to do what I think the EMR should do, which is be able to assist you with taking care of the patient without ever seeing the patient. And so, with that, Dr. Sachse, with one finger up in the air, was able to control me. I learned since then that he can still raise his finger. He can't control me as much anymore. His story is fascinating. His story is as long at Baystate as the United States is nearly a 50-state union. If Alaska and Hawaii were in 59, the guy came here in 62. He's been here for NPR existed 20 years after he came here. I'm serious. FM radio. I was trying to do this thing about trying to look at, in 50 years, what is done, and I tried to do a tweak on radiology and radio. So the first FM antenna where multiple radio stations could feed through, Empire State Building in New York, was in 60, right? Phenomenal that someone, not as part of the medical staff, not as out there, but the guy has done so much to this institution, he clearly is the institution. The fact that he has been here and done the number of things that he's done in those decades is awe-inspiring. When I talk to my bosses, both Kevin and Evan, I said, do you realize, I don't think any of us, that's why I kept on asking, for the people who are 45 years, how many more years? Because 50 years is freaking amazing, right? It's amazing. So nonetheless, he was born, he went to school in Munich at a place that I cannot even come close to describing. Where was it? Where in Munich? Where in Germany?
What school?
Yeah.
The Luitpold Oberrealschule.
Thank you. Your name was easy. He then graduated and got his MD degree in 1956, right? Out of the University of Munich. Amazing. Right? And then for some reason, stayed in Germany, was in general practice, which I imagine is a European thing, and then said, okay, forget it, I'm going to the oasis known as Lawrence General. You're going to tell us that story. And then from there, jumped back and said, Lawrence is not the answer. Back to Munich, where pathology? So I'm reading it. Pathology, right? In 57. In 58, then to a place that perhaps had a better, at that time, maybe a little better reputation than Lawrence, but the Brigham. Not so sure which one's the toss-up winning now. Has had a list of academic appointments that is no greater than 2. He's been a stinking professor his entire life, right? Yeah, whether it's associate or assistant, blah, 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 doesn't matter. The man is a teacher. The man is a professor. The man is phenomenal. He then had hospital appointments that, once again, really ticked me off. President of the medical staff before my time, right? 22 years. It's like, how does that work? But president of his medical staff back in the early 80s. He clearly led the division or department of radiology for about 300 years of those 50 that he's here. And with that, still to this day, is being honored by his residents as being an outstanding teacher. And I forget the year that you got the award most recently. Was it 2 years ago? But I mean, geez, you know, 50 years in practice for me, people are going to shoot me dead. Okay? People are still honoring him. They've honored him in such a way that I think it's really impressive. And unfortunately, Jim Polda's not here today because I think he's about 35 years in. But they've actually gone ahead and in the Department of Radiology created a Eckart Sachsse lecture series. And it's to look at what the older technologies. I'm going to blow this, so I apologize. If there's someone, Steve, in here.
It's for
Can you tell me the
correlation of plain films and fluoroscopy with more advanced imaging.
That's why older didn't really sound right. But you know what started in radiology back when they started thinking that contrast was actually going to improve radiologic procedures? Right? That was back in the late 50s that they started using contrast, if I remember correctly with my reading last night. So with this lecture series, I don't know if it's going to be an annual thing, a semi-annual thing, a quarterly thing, who the heck knows? But what I'd like to do is encourage all of us to participate financially in supporting two people, and I would have done Jim the same way, because I think Jim Polda is a phenomenal person. But the Eckart Sachsse lecture series, if you could find it in your time, to throw a couple of bucks that way, to make sure that we honor a stinking feat that we might never see again by someone who is not just part of the medical staff, but is the medical staff. And with that, to be honest, I'd like to go ahead and start. I'm going to start, and we'll talk about the dollar amount as time goes on. All right? It depends how well you stay to your time period. But I greatly appreciate the opportunity and the honor to thank you for 50 frickin' years.
Thank you all for coming.
Bill James, who also was a president of the medical staff, whose photo was one of the ones that I think included Max Cloud, Phil Stoddard. Bill James, when he completed his term as president of the medical staff, a 2-year term, was a big meeting, dinner meeting at the time, I believe. There were trustees there, chairpersons, vice presidents, senior vice presidents, the works. And Bill James got a standing ovation at the end of his term. And Bill James, who had that wonderful, dry Canadian humor, said, "By the way, if you believed as much as half of what you just heard about me, you should be kneeling and not standing."
What I'm trying to say is
What I'm trying to say is that Jeff Mulhern made me out, maybe to come out to look a little better than I really am. But anyway, thank you for your kind remarks, and thank you all. Now, if I may, I would like to introduce 4 members of my family who are here because Jeff invited them. So first is my oldest daughter, Linda Campanella. You can stand. Okay. Her husband, Joe. My son, Eric. And my son, Claudia. Claudia's twin sister is too far away on this globe and couldn't make it. In terms of the number of photos that were here, I didn't want to force them on you, but Jeff said, bring me some photos to see what you really looked like before you became an old man. So here I am. Now, I'd like to start by congratulating all of those who were honored today, and I want to also congratulate all of those who are not being honored for being members of the staff at this, I think, very wonderful hospital. Jeff asked me to give her some thoughts of my perspective, what's happened in medicine in the last 50 years. I'm going to take a rain check on this, but I'd rather talk a little bit about how the Department of Radiology has changed since I came. I mentioned to Dr. Benjamin that many years ago I reviewed the annual reports of this hospital going back to the early 1900s. And the term X-ray was first mentioned at the annual report in 1907, which makes me assume that we had our first X-ray unit some 12 years after X-rays were discovered. Now, somebody once asked me, was I trained by William Conrad Röntgen who discovered the X-rays? The answer is no. He died long before I was born. But in terms of the radiology department, you might be interested to hear that until 1952, radiology services were provided at this hospital by a part-time radiologist who came 2 hours in the morning and 2 hours in the afternoon. That was John Turner. John Turner in 51 was offered to take over the Department of Radiology on a full-time basis, and because he had other commitments, he declined, and Bob Grugan became the first full-time radiologist in 1952. Until 1960, this was a one-person department. In 1960, Bruce Stoller became the second radiologist, but he lasted only about 1.5 years because he ended up taking over the Department of Radiology at the Providence Hospital. So I was hired by Bob Grugan in 1961. He took an awful chance, didn't know what he was getting into, and I became the second radiologist in May '62. And a month later, it again was a one-person department because Grugan took a 1-month vacation. This is how it was 50 years ago. We've come a long way. Some of you may know that 50 years ago and 60 years ago, radiologists were trained in diagnostic radiology and radiation therapy. We called it radiation therapy at that time, not oncology. So one of the duties I had when I came here is to become familiar with a cobalt theratron junior unit, which was our way of delivering radiation therapy. And it wasn't until 1972 when Warren Park joined us from Sloan Kettering in New York that I wasn't in charge of radiation therapy. Beginning in the late 60s and early 1970s, it became very apparent that we needed to do some subspecialization in the Department of Radiology rather than run it with generalists. And I'm known as a generalist. I've always been known as one of them and will until I die. But it was started in part because of Dimo Dasko, who is one of the next honorees for 50 years, hard on my tail. So, Dimo, are you here?
I'm here, yes. I know that you started the radiation therapy here.
No, I didn't start. That's no credit to me. I did not start.
Well, you gave radiation to patients that had a brain tumor for
Well, that's correct.
And it was you.
That's correct, but I didn't start radiation therapy. When I arrived, we had a cobalt theratron junior unit, And Bob Gruden did radiation therapy too.